So good morning, and it is still morning. In 5 minutes it will be afternoon. And I know my address this morning is the one that is keeping you away from your tea break and something to elevate those sugar levels. So I just wanted to say what a privilege it is here to be today. And just saying is good morning, and also acknowledging Dr. Manshri Kumar, Joint Secretary of Minister of Health of Government of India, Dr. Rajesh Gokhale, Secretary of Biotechnology, Government in India, and other dignitaries and distinguished guests. So I will be giving a quick address this morning and an overview of the challenges we see at a global scale relating to that of sustainable and equitable access to medicines and vaccines. So this is the address and the content I will be addressing this morning, just as a snapshot. So let's get started going. So Takeda is a global biopharmaceutical company, and as you've heard this morning from Annapurna, we have a legacy of more than 243 years, which we are very, very proud of. We've got approximately 50,000 employees. We are headquartered in Tokyo with a global hub in Boston and incorporated in India since 2011. We focus our efforts in discovering and developing life-transforming treatments across 5 therapeutical areas, of which 4 of these therapeutical areas are available in India. Neuroscience is the exclusion, which we have got several products in development and assets in our research and development, and hoping to bring that into the future in India. So that is a little bit about Takeda, but what I really want to talk about this morning is about inequity and about how the developing and discovering of life-transforming treatments, medicines, and the vaccines only matters if people that need them can get access. The Sustainable Development Goal of Health and Well-being, as we very much know, is one of the 17 Sustainable Development Goals. And we've seen great strides that has been made in the elements of health and well-being. However, what you can see on this slide, there is still an urgent priority to focus, to close the gaps in achieving our Sustainable Development Goal 3. Well, we've seen overall that some elements has been progressing, especially that in addressing the challenges of childhood mortality, AIDS, and neglected tropical diseases. Examples that we've seen to date, the reduction of child mortality has seen a great improvement in the last decade. In 1990, it was estimated that under the age of 5, 12.6 million deaths of children. Where we are in that of 2020, it has been reduced to 5 million. The UNAIDS data shows that in 2020, 29.8 million people living with HIV was able to access life-saving treatment of the estimated 39 million people living with HIV. And more, we've seen a great progress that in more than 1 million patients has been able to access life-saving treatment for AIDS and HIV in 2020, 21, and 2022. And what is so significant about this? If we are able to keep that momentum in enabling a broader access, we will achieve the goal that by 2025, 35 million patients could get access to life-saving treatment. Moreover, what we've seen in 2021 is that 25% less interventions was needed for treating neglected tropical diseases. And between 2016 and 2019, 1 billion patients has been able to get access to treatment for neglected tropical diseases. But what you see on this slide here is that we've got a growing disease burden of neglect and of non-communicable diseases. And this is something that is quite prevalent, especially in our populous countries and growing economies. So in recent years, we've seen some of the elements of that of Sustainability Development Goal 3 that has been slowing down. Countries has got a huge debt burden. We also see growing borrowing and lending from emerging economies. And what it has also indicated that what we've seen overall, because of these economical factors that we see, countries have got a huge struggle. And we also understand that within the current environment, that there are several factors that is contributing to these challenges. The three metrics that we show here indicates that there's still a lot of work that needs to be done in reducing the cancer deaths, universal healthcare coverage, and the increase of healthcare workforce, excluding that of the US as well as Russia. In the most populated countries in the world, only US, Russia, and Brazil are closing the gap between that of economic loss and that of the disability-adjusted life years. In particular, many larger economies, including India, China, Indonesia, and Mexico, we are seeing a growing gap. Greater forms of government support is needed. National reimbursement has been shown as one of the elements that is effective and an enduring solution to many of these challenges. And as we've heard this morning, is that there is a disproportionate element of burden that is put on households to cover their daily costs, as well as the spending and out-of-pocket markets to get access to healthcare and medicines. In India, that is no different, where the majority of households are facing catastrophic elements on financial elements because they need to pay out of pocket for their healthcare expenditure and medicines. Of course, we understand that these elements, and there's a lot of pressure on government because of the current uncertainty of the economics that we are seeing across the world, as well as understanding that it takes years to develop these healthcare systems. But what we've seen on this slide, that greater investment into that of health does provide a better health outcome for all. So what is preventing us from achieving our sustainable development goal? We see this in three elements: that of the availability of our medicines and vaccines, the accessibility of the medicines and vaccines, and sustainability within the systems, the programs, and that of companies to continue to provide access to the medicines and vaccines. So as Takeda, we believe we've got a role to play, and our positioning on enabling a sustainable access to medicines and vaccines, we believe it needs to be done in an integrated approach as part of our business. We also believe that it needs to be done in a collective approach by mobilizing collective action across the ecosystem, and it really needs to be hyperlocal. So how can we as a company play a role, and how do we see that biopharmaceutical can play a role in this public-private partnership framework? The first element is looking at that of bridging the affordability gap. NCDs, as is globally the phenomenon currently, is also an increasing trend of that in India, where we currently see that the NCD trend is driven by the growth of cancers, and where it is estimated that more than 40% of the NCD-related deaths in India is as a result of cancer. In addition, that most of the patients in India has got a huge element of paying out of pocket to enable them to get access to effective treatments, which in itself is not sustainable. So how can we as a company be a bigger part and a solution orientated within this framework? Number one is, well, I think our first responsibility is making the medicines available in India. It's also how we price our products. We do not price our products a one-size-fits-all. We follow a tier pricing approach whereby we take into account the economical dynamics of a country, the maturity of the healthcare system, as well as the out-of-pocket expenditure. In addition to that, we believe that we can also play a partnering role in bridging the affordability gap to ultimately enable a broader access to patients that requires life-saving treatments. The second aspect that we look at is that of strengthening the healthcare system. The affordability aspect, as we heard this morning, also from Annapurna in the panel and from several of our speakers, the affordability is the tip of the iceberg. However, there are multiple barriers across the patient journey. Access is complex, and it is very much hyper-local and very specific to the local elements on the ground, as well as the disease state in which patients are seeking treatment. For this reason, we believe we've got a role to play in partnering with partners to address these barriers across the patient journey. This is a case example of how we partnered, and this is an initiative we started in 2019 in Meru County in Kenya. So Meru County has got 1.5 million patients. So we piloted a project to see how we can partner with several local partners, NGOs, government, municipalities of the specific area within Meru County to address the barriers across the patient journey. And so ultimately what we've seen out of this is that we have been able not to only find that it is scalable, but it is also being adopted into other areas across sub-Saharan Africa. And based on these learnings that we've had, we are also implementing this across the globe in our partnering approach of how we, as a private sector party, can partner more effectively in a broader framework. And the last element to look at is that we believe that as a private company and a biopharmaceutical company, we have got the responsibility to create stakeholder value. And that means long-term stakeholder value. And that is to our employees, our patient, and the broader society. And we have several initiatives, last slide, that we put in place. As my time is up, as the buzzer has indicated, I think the last slide is key takeaways to take out. What we believe as a company where public-private partnership can play a role. Firstly, integrated, local is the key word, and it takes a spectrum across the patient journey. And in this way, we can ensure public with private can have a sustainable framework to endure access to a broader population. Thank you.